Welcome friends. Today we are here to discuss about the COVID-19 pandemic and its impact on third world countries. So basically why we are discussing the third world countries, we know that the third world countries are not capable to fight with COVID-19 pandemic and there are so many people are dying in third world countries. So this topic I have chosen to discuss. This topic already I have presented in one of the international seminar, but they didn't give me time to present, so that's why I left over. So here I am again presenting my topic in front of all public. So first we're going to discuss about this the data I have not updated. The last one is there in the World Health Organization. Whatever is there, till the July itself, you can see that the number of cases here mostly increasing in United States and the Brazil and the India. So this way you can see that even Argentina is there and the South Africa is there. So most of the developing country, they are already increasing their COVID-19 cases. So let's focus first how this will going to impact. Before we have to know the what is the economic already. So you can see that in the economic recession, if we will going to trace the data from the 1871 to 2021, we can see that this crisis in the post law or during lockdown is even more than the 1929 economics crisis. So you can see that this the already the major economy in which already we have focused the China, US and Euro. In the beginning already you can see that all the countries were have affected. So China became the 1% of GDP. In the -8, US is going, even the Euro is going -10. But the expectation what they are having in the 2020 2021, they will again increase. But these types of data is not having in the case of third world countries. Almost all the section you can see that the US economy has shrink 5.9%, the Eurozone about 7.5%, even the Germany has shrink by 7%, and the Italy is 9.1%, and the British economy shrink 6.5%. So you can see the already, if we are going to discuss about the first world and the second one and third world, I have not included China because China already itself they like claim about the third world country, but because as per their economic resources and their technology they are not third world country. China is not third world country. So most of you can see that the cases is growing in the third world countries, mostly third world country. You can see that from the Mexico, Latin America, Africa and of the South Asian countries are this third world countries. And most of the third world countries have faced economic recession in their lockdown period. So all over, if we are going to see how this affected, we know we till the year 2019, September 2019, around the IMF has declared around 86 trillion world economy we are having. And this data comprise 193 countries. But the reality itself, you will going to shock. The only 7 countries are sharing 45.27%. It's almost half of the world economy is shared by the US, Japan, Germany, UK, France, Italy and Canada. So even the cases will going to increase, they can handle easy way. But the other side is how the other third world country will going to increase. So this is the part already you can see that this the GDP, if we will going to see the GDP, the United States, Japan, Germany, even the just forget about the India, even the United Kingdom, and these countries are they are having the largest GDP in the world. And you can see that other sides, even I have shared, these are the country those who are having the population wise. The population in India is maximum, the United States is there, even the Brazil is there, Bangladesh is there, already few countries, not I have included all the countries, but I have compared mostly the first world and the third world country. So in the you can see that as per their already population, their GDP is not supporting. So that's why in the health structure you can see that the United States and the Germany and the France, Japan, Kingdom, UK, Italy, Argentina, they are expensing much on their health expenditure. And you can see that the India is nowhere. Even the Bangladesh, the third world country, is not spending on the like health, but they are spending on the maximum arm monthly. Other side, what is the main detail we have to discuss? This the COVID-19 cases started from the Wuhan, China, and in the beginning you can see that this 31st January data I have accessed from the World Health Organization, and they have already the China were high and the regional level already and the global level high, and there is no other countries is reflecting, only China and the outside China. But the other side, just after the 1 month data, you can see that it's reached the globally more than, yeah, it's 9,000, then it's 85,000, and in China, and again the outside is more than 6,000 cases. So in the March month, China became nowhere, but you can see that all the global countries are in the list. In the 30 April again I have shows the same way it's going again in the March and the April, and maximum are the third world countries, and every single data is available on the World Health Organization. So you can see that the number of confirmed COVID cases reported in the last 7 days is on the 25 May. You can see that these are the mostly area, and these are the third world countries having high. See this report, because earlier they were having on the like day wise report or the monthly wise report they were having. Now they are counting in the 24-hour basis. So earlier they were having the continent wise, now it's came to the city, even the like even the area wise, even the small district, and even the apartment is counting. So this way the cases, if will of course will increase. This how these cases is increasing. You can see that in Africa, in the Southeast Asia, even in the Eastern Mediterranean, and these the cases were increasing at a very high peak rate. This is the already this United States, Brazil, this sequence I have shows, so you can understand how the cases were increasing mostly in the third world country, and there are already few, and the first world country, but they are going behind in the list. Earlier the sequence were having mostly the first world country, but now in the queue already the third world countries are coming in the first row. So this is why, if on the one hand third world countries are having the maximum injury, but and there are no cooperation from the first world countries. So you can see that the problems of the third world countries are already famous for their, the emerging economy, but they are also famous for the poverty, unemployment, illiteracy, economic inequality, religious conflict, civil war, and almost all kind of health problem is in already surviving in the third world country. Hunger is there, starvation is there, the trafficking, illegal trafficking, everything, organ transportation, everything is already in the third world countries. So here you will going to see the data already. The India, Mexico, Brazil, and the Bangladesh, they are increasing very high rate. The problem itself, why the cases are increasing, because they are not having the proper checkup facility or the quarantine facility, or the health expenses here that much high. The people, even the middle class people, cannot bear the expenses. In India already, the private hospital, they are charging more than 1 lakh to 10 lakh for just admitting the patient itself. Even most of the hospitals are denying to admit. They are not having proper bed. The government is trying to manage the bed itself, but still they are lacking bed. So this is the problem here, that on the one hand there is no proper checkup is there, on the other hand they are hiding data itself. So because there will be no panic, and the country will going to open the market itself. Media is not allowed to show the cases. Media is completely denying all the cases, and they are not doing anything. There is no bed available, and the hospital are denying to admit the charging, or they are charging high. These are the cases where happening in India. and the third world countries. Even you can see that even in Africa they has already. So others, how this lockdown will going to affect the third world countries, including the how this lockdown will going to affect the third world countries economy. All the third world countries economy is already in the debt, and the most of the third world countries is running on the mostly on informal sector. The India is having 94% informal sector. So these are compromised, the small scale industry, handicraft, restaurant, construction workers, construction site, migrant worker, poverty, these are the informal sector will going to affect. Poverty will increase, unemployment will increase, medical emergency will happen, the loss of trade will happen, tourism will going to affect, and the developing remittances already. And the otherwise what will going to rise, the digital platform, e-commerce, the remote working and the learning will going to rise, the telemedicine and the delivery service and foreign direct investment will going to rise in the third world countries. So who will going to get the benefit? Again, the first world country will going to get the benefit because they are having the maximum investment capacity, and the other side, the small scale industry and all the small input will going to collapse in this lockdown. So you can see that even the IMF right now is giving loan to even $1 trillion proposes to support the country. So this is already you can see that its purposes, even they have given loan. They are not giving aid already, they are giving loan to aid India COVID responses. So it's again have to return. So Myanmar $6-7 million from the IMF loan. Even the ADB Asian Development approved the US 1.5 billion loan. So these are the all having the credit already, that these countries are in the debt. How they will going to return the money? Of course, they will going to include the foreign direct investment in their country, and the foreign direct investment already again affect their labor market and the other market. So there will be again employment, unemployment, or the problem will increase. So you can see that even after the problem they are facing the third world country, but they are bound to open their market, because to reduce the loan capacity, or they are reduce the taking loan. So they are already they have opened, they don't know that they are the already the COVID problem will going to affect more and more people, and the death and the casualty will happen more, but still they are not having any other options. So that's why even the facing worst humanitarian crisis, since this is the one of the most all the worst humanitarian crisis since the World War II we have faced. And in the conclusion, what we're going to see, there's already the 70% of total employment emerging in the developing countries are coming from the informal sector, and this is they are contributing about one third of the GDP. So if the third world country, of course, will not going to take the effective measure, of course that will going to affect. So what are the effective, the community spreading, they anyway they have to stop. They have to introduce the nationalism privatization. So nationalism privatization means the national level privatization will going to introduce, then it will be better. Other side, the debt anyway they have to control, so debt will not going to take much more country. So how will they have to increase the taxes on the every single product that whatever they are importing from the other countries. If the nationalism succeeded, then they will going to survive, and the other side they can avoid the debt itself. So other side, the other side, the downside of scenario is their global growth could be shrink by almost 8% in 2020, and there is non-cooperation from the developed country towards the developing country. So this is in this already, if the developed country will not going to help the developing country during this lockdown or COVID pandemic, of course the difference or the gap between the global south and the global north will going to increase in future. Even even the chief already the medicine will be even the already founded, or they will going to evolve the medicine, they will, but that will not going to affect until unless that is cheap, because the poor people are unable to buy food for them. How they will going to buy the machine for them. So with this already conclusion, I am going to end here, and please, if you have liked my video, please subscribe and comment in the comment box and give your feedback. So that will help me to improve and encourage me to upload the next video. And thank you for subscribing my video.